Hello and welcome to what I hope is going to be the first in a series of short, about 10-minute videos where I'm going to look at pain and how it can be managed. Why pain? Well, professionally, in my old career as a pharmacist, I used to regularly be giving out various sorts of pain relieving medications. In my new career as a therapist with various therapies, a lot of them are useful for pain and or stress. And if you have chronic pain, that can be hugely stressful. I also have a personal reason for starting these videos because I'm newly diagnosed with a chronic pain condition, osteoarthritis, something which I know is not going to get better, and it's up to me to manage it. And to do what I can to stop it getting any worse. So why have I decided to do videos? Well, because I have got a large number of techniques that I can talk to people about that are useful for pain. Obviously, with my ex-pharmacist head on, I do know rather more about the medications that people can be on than your average therapist. Drugs were my speciality, but I must put a big disclaimer in here. I am no longer on the register. I am a retired pharmacist, and if you have any queries about your medication, you need to go and consult your regular pharmacist. But if there is something that, a question you want to fire at me that's specific to a medication that you're on, I will be happy to answer it to the best of my ability. But before you make any decision regarding medication, you must go and talk to your GP or another doctor or the pharmacy that you normally go to. So, having said that, the first thing I want to say is that there is absolutely no magic bullet for pain relief. There is no one size fits all, whether it's in terms of medication, the types of medication, the specific medication, and different techniques are not guaranteed to work. It really is a case of finding what suits you. And that actually brings to mind one of the big things about pain relief, or rather more about pain, because a lot of pain, obviously there's a physical aspect to it, but there are huge mental aspects to it as well. An awful lot of pain reflects what's going on up here in your brain, and there's a reason for that. Disclaimer, no way am I saying that your pain is imaginary. It's not. But pain receptors are in the brain. And basically, you don't go ouch until something has triggered the pain receptors in your brain. And there are a number of different ways in which the journey of the pain stimulus can be interrupted before it gets to the brain. It also means that things going on in the brain can affect the sensitivity of your perception of pain. I mean, we all know that a level of pain that one person is quite stoical about will reduce another person into, screaming agony. A lot of pain is in the mind, not imaginary, but modulated by what's in the mind. And in a way, this is borne out by the fact that for all the standard pain medications, your paracetamols, your ibuprofens, whether it's gel or tablet, or, you know, the stronger things like codeine, morphine, fentanyl, whether you have it as a patch or whether you have it as a tablet that you take. All of these medications in the trials have been shown to be better than placebo. But being honest, there is a huge placebo response to the simple act of putting on or using or taking something which you will believe is going to relieve your pain. There is a massive placebo response. And in a way, the quest for pain management is your quest to find the technique or the drug that works for you while causing the minimum amount of side effects. Now, please don't get me wrong. I'm not saying drugs don't work. I'm sitting here using a cocktail of paracetamol and ibuprofen gel, which is helping me. But I know that actually my best way forward is to keep mobile. So exercises are a huge part of what I'm trying to do, as is diet, which is something I might touch on in a future video. But every time I apply my ibuprofen gel, I can't help wondering whether I would get the same or a similar response if I just applied a massage oil or something else. Probably wouldn't get quite as good an effect, but there is no doubt that the belief that something is going to help your pain is actually a massive part of helping you control your pain, which is why there is no one size fits all, because we all have different paradigms for what is going to work. One of my favourite therapies is Reiki, which, if you don't know, is an energy healing system where this is where it gets all spooky, I channel energy from outside me through my hands into the person I'm trying to treat. And I used to give Reiki at a hospice, and the patients I gave Reiki to loved it. They got really relaxed, and if they had pain, it would help them. You know, even if I wasn't applying the Reiki directly to the pain, it helped them. But Reiki applied directly to the painful area can help. Now, I know there are studies which show that in many respects, Reiki is just eliciting a placebo response. And you know, I don't mind that. I really don't mind that. Because for me, the word placebo doesn't mean, oh, this is bunkum, it doesn't work. Placebo is a way of saying, oh, right, I've mobilised my body's own natural healing resources to help me manage this. So I really don't care if anyone, and some of my pharmacy colleagues used to tell me that Reiki was bunkum and it was, you know, all hokum and I was a snake oil salesman. I used to get quite offended. But I know there is a huge placebo response. I guess what I'm hoping to do in these videos is to help you find your own best way to elicit your own best placebo response to help you manage your pain in a way that suits you. So I'm planning on doing these videos weekly. They'll be going up on my Facebook page, my YouTube channel, but they'll be short enough to go on Instagram as well. So a number of ways you can find these videos. Feel free to share them. And if you have any particular topic that you would like me to cover in the next video, just DM me however you found this video, and I will respond to requests. And in the meantime, to anyone watching this video who has got a chronic pain condition, I'm not going to say I know what you're going through, because I don't. Everyone's pain is different. But I am going to say I have some appreciation for the problems that causes you, and I hope that I'm going to be able to offer you some helpful things that will make your life and your pain more manageable. Thank you very much for watching.